Okay, my name is Dr. Smith. Can I just confirm your name and your age, please?
Yeah, I'm Alice, I'm 25.
Okay, nice to meet you, Alice. So, I've been asked today to examine your feet and ankles. This will involve first watching you walk and then inspecting both of your feet and ankles, then feeling around the joints for any tenderness or pain, and finally assessing the movements of the feet or the ankle. Does that sound okay?
Yeah.
Fantastic. Before we start, can I just ask, have you got any pain?
No.
Brilliant. So, the first thing I'd like you to do, if that's okay, is just walk to the end and then back again. I'm just going to watch you walk. That's fantastic. So here, we're looking at the gait cycle, looking for any abnormalities, either in the heel strike or the toe off phase, for example, looking for any asymmetry, the ease of turning, and then noting any discomfort, which fortunately isn't present today. Okay, next can I just ask you to do the same again, but this time walking on your tiptoes, if that's okay. So this is a good way of checking for any neuromuscular dysfunction, and any inability to do this could also indicate pain or inflammation of the calf, the Achilles, the ankle or the foot. That's great. And finally, can I ask you to do the same, this time just walking on your heels, if that's okay. And this checks for problems in the anterior compartment of the lower leg. That's fine, Alice, that's great. And again, sometimes pain in the foot or the ankle can prevent that being able to be done smoothly. Finally, on the inspection at this stage, I'd inspect the shoes to look for any unevenness in the wear on the soles and the presence of any orthotics, which we've not got today, which is great. So on to inspection, so I'll just ask you to face me if that's okay. So here we're looking for any asymmetry, for any swelling, for any erythema, or for any scars around the ankle or the foot, which could give us some clues. We're also going to the toes, looking at the condition of the nails, any deformity of the toes, such as clawing or deviation, and finally for any skin problems such as calluses or corns, which could also give us some clues as to whether there might be a problem. And fortunately, we've not got any problems there either. So that's fantastic, Alice. So I'll just ask you to pop yourself on the bed, if that's okay. So next we're moving on to palpation. So I'm just going to feel around the feet or the ankle. Please do let me know if this causes you any pain. Okay. So the first thing I'm going to do, just straighten your legs down, is just feel for the temperature of the foot and the ankle. Just comparing both sides and then comparing it to the lower leg. And if you did feel any warmth there, that could indicate an inflammatory process going on. Next we're going to move on to checking the pulses. First of all, the dorsalis pedis pulse, and then the posterior tibial pulse, and then moving on to the soft tissues. So first of all, we'll start with the Achilles tendon, just going down that, then onto the plantar fascia. Pain at the origin of the plantar fascia here can indicate plantar fasciitis, and that pain could be exacerbated by the windlass mechanism, which is hyperextension of the great toe. Then we're on to the lateral ligaments of the ankle, which is three main ones: the anterior talofibular ligament, the calcaneofibular ligament, and the posterior talofibular ligament. And tenderness or swelling there could indicate a problem. Okay, now we're on to the bony landmarks of the foot. We're going to start with compression of the metatarsophalangeal joints. If pain was a problem here in the web spaces, a common problem is Morton's neuroma, commonly in the second web space, sometimes a third web space, and a palpable click or pain elicited on compression of the joints, called the Mulder's click, can be a positive sign for a Morton's neuroma. Next, we're on to assessment of the metatarsal bones, specifically paying attention to the second metatarsal bone, which is commonly injured in a stress fracture due to a high level of load being put through that bone. Onto the fifth metatarsal, which can be fractured associated with an inversion and injury of the ankle. Then moving on to the calcaneum bone, just trying to elicit any tenderness. Onto the talar dome and the anterior joint line, palpating for any osteochondral defect or pain. Then the lateral malleoli, the medial malleoli, And finally the distal tibia, the distal fibula. And there's no pain there. Was that all okay?
Yep.
Fantastic, okay. Now we're going to look at the movements of the foot. So we're going to start off with active movement. So can I just ask you, Alice, at the same time, can you just draw both feet upwards if that's okay? So that we're checking dorsiflexion. Now both feet downwards, fantastic. We're looking at plantar flexion there. Now could you try and turn your feet inwards? We're looking at inversion. And then outwards, looking at eversion. And finally, can you just flex your toes, so turn them over, and then draw them up as far as you can. Fantastic. Now we do the same again, but this time passively. So we're going to check dorsiflexion. We should be able to get 50 degrees of movement there. Plantar flexion, should be able to get 20 degrees of movement there. Inversion, should be able to get about 35 degrees of movement. And eversion, should be able to get 15 degrees of movement there. And finally checking the range of movement of the great toe. Here a restricted range of movement, or being able to palpate crepitus could indicate or could be associated with hallux valgus. Okay, so if we did detect any problems in the range of movement, we'd do the same thing on the other side just to compare sides. Okay, so next we're on to resisted movements. This can be useful to check the neuromuscular function of the lower limb and foot, and also sometimes pain or tendinopathy can also cause problems here. So first of all, can you push down on my hand? That's resisted plantar flexion. Push up on my hand. That's resisted dorsiflexion. That's great. And then push down on my finger and pull up, and that's checking the strength of the great toe movement, which is fantastic. Okay, so next we're on to special tests. The choice of these would really depend on the history or the findings in the examination. A couple of sets of tests that I'm going to do today will involve checking the lateral ankle complex, which you do in a sprain injury, and then looking at the Achilles. So in an inversion injury, if you suspect an injury to the ankle ligaments, one thing that you could do is check the integrity of those. So the first test you can do is the anterior draw test. Here you stabilise the lower leg and then apply anterior force, feeling for a firm end point, and if there's any pain or laxity, checking that and comparing it to the other side. The second ligament which can be injured is the calcaneofibular ligament. This can be tested by forced inversion, and again pain or any laxity could indicate an injury there, and again you want to compare that to the other side. In a severe ankle sprain or an inversion injury, if you did suspect that all three ligaments were injured, you could then go on to do a couple more tests and checks of the ankle. The first would be to palpate the talar dome and the anterior joint line for any osteochondral defect or pain. You'd then feel down the fifth metatarsal to check for any associated fracture there. And one other thing you could do would be to check for the integrity of the syndesmosis fascia between the tibiofibular joint. One way of doing this is to apply external rotation to the foot, which could elicit pain. Or do the squeeze test, where you apply lateral pressure on the tibiofibula, and a positive test would be elicited by pain at the distal syndesmosis, distal to where you're applying the pressure. Okay, so next we're on to the Achilles, just to finish off with. Here you palpate down the Achilles tendon, all the way down, feeling for any tenderness, swellings or thickness. At the insertion of the Achilles tendon, we'll be feeling for any bony spurs or bursa. And finally, Alice, if I can just ask you to just flip onto your front, we're going to do something called the Simmons test. And I'll just ask you to just shuffle down a little bit, that's fantastic. Here we squeeze the calf, which should produce, like it does here, plantar flexion. The absence of this could indicate a rupture, and you can also look for a buoyant endpoint, which should be present with an intact Achilles. And that completes the examination. Thank you very much, Alice. So today we did an examination on Alice, who is a 25-year-old female. We examined her foot and ankle on inspection. She had a normal smooth gait which was pain-free. There was no abnormalities, swellings or deformities on inspection. Palpation revealed no tenderness or swellings, and she had a full range of both active and passive movements. The special tests on the Achilles and the ankle ligaments were all normal. So this was a normal exam. Depending on the presenting complaint and the findings on the examination, we might want to complete the examination by assessing the knee, the hip, and possibly the back, looking at the sciatic nerve. It also may be useful to do a full neurovascular examination of the lower limbs. In addition, if there was any previous imaging available of the ankle, then that might be useful to give us some clues.